We are very excited that you are joining us for this hour. My name is Nora Diaz-Vasquez, and I am a career counselor with the Career Development Center. I'm also the career liaison to the College of Health and Human Services. So it looks like we have about 150 participants total. So I'm really excited for our panelists today. We have 5 great alumni from the College of Health and Human Services, and they are representing departments from nursing, speech language pathology, physical therapy, kinesiology and athletic training, as well as social work. We also have Dr. Saylor, who will be moderating the panel for us today. So thank you so much, Dr. Saylor, for being here. And just as a quick reminder for those of you that may have any questions, we are using the chat feature. So through this webinar, there's a Q&A and a chat, but Damien and I will actually be moderating the chat. So make sure you type in your questions into the chat, and then we'll try to interject those throughout our panel today. So again, if you have any questions, go ahead and type those in. And at this time, I'd like to hand it over to Dr. Saylor.
Thank you, Nora. This is great. I'm looking forward to today. I really am excited to hear the stories that come out of our great panelists today. I'm very impressed by the number of people that are attending. I'm glad that you're here with us. I am Dr. Scott Saylor. I'm the chair of the Department of Kinesiology. My professional training is as an athletic trainer, and we have a dear colleague of mine, Brittany Clayson, with us representing athletic training. So she'll answer any questions regarding that profession. And I serve as in an associate dean role for the College of Health and Human Services. So I don't want to take any more time, introduce myself because we've got some great people to meet. I have a list here, so I'll go. They're not in any particular order, but as we, let's start off with each of you introducing yourself, kind of your academic pathway. Some of you have a degree or 2 or 3 from Fresno State or other places, and then what your current position is. So let's go down the list. Justin, if you wouldn't mind starting us off.
Sure. Hey, everybody watching. My name is Justin Lemoyne. Academic pathway. So I actually started out in Modesto, California, so Northern California. Got my associates there in health and physical education. And then I transferred to Fresno State fall 2013. So that's when I started with the kinesiology, exercise science there. Yeah, woo. And then went into the physical therapy program at Fresno State in 2017. And I just graduated May 2020 last year. So currently I'm working in Bakersfield, California. I'm at an outpatient physical therapy clinic here called Paranorata Physical Therapy. So I've been here for a couple months. I was at another outpatient in Bakersfield before this one. But yeah, I'm just starting out right now in the outpatient setting, really enjoying being able to work, not having to worry about homework or anything after so many years. But yeah, that's kind of my journey through my academics, and then now working here in Bakersfield.
Awesome. Thank you, Justin. We'll go to someone else who happens to be in Bakersfield. Let's go to Vanessa.
Hi, good afternoon, everyone. Thank you so much for joining us. My name is Vanessa Rodriguez, and I actually attended Fresno State with a bachelor's in social work, and I graduated in 2019. Right after I attended CSUB and got my master's there. I did an advanced standing program, which was just 1-year program. And then after I completed that, I applied to jobs and I earned, right now, currently, my position is behavioral health therapist. I am an associate clinical social worker and I'm working under Clinica Sierra Vista.
Awesome. Thank you, Vanessa. Okay, Megan, how about you?
Hi, everybody. My name is Megan Perschall. I'm originally from Porterville, and that's also where I received my associate's degree over at Porterville College in communication studies. I then went on to Fresno State to receive my bachelor's and master's degree in speech language pathology. And now I currently work in Fresno for Clovis Unified School District full-time as a speech language pathologist. And then I also work per diem at San Joaquin Valley Rehab.
Oh, awesome. Thank you, Megan. Brittany, would you mind introducing yourself?
Yeah, good afternoon, everyone. My name is Brittany Clayson, and I was born and raised in the Valley. I graduated from Buchanan High School. So as I was looking for colleges, Fresno State was kind of the clear choice for me. I graduated from high school in 2005, went into college. I originally wanted to be a math major. And after a year of math, I decided that that wasn't necessarily for me. So I changed my major to kinesiology. And I ended up graduating with a degree in kinesiology and an option in athletic training. But I also completed all of the requirements for a degree in exercise science as well. So I graduated in 2010, and then I got my certification. So I'm a certified athletic trainer, and went on to get my master's degree from Fresno State as well, and decided to do that in sports psychology. So it's still an option in the Department of Kinesiology. And then after graduating in 2012, I was kind of doing both, a practicing athletic trainer and teaching at Fresno State in the Department of Kinesiology. And then in 2017, I decided to stop practicing and just go into teaching. So my current role is that I'm a lecturer and the clinical education coordinator for Fresno State's athletic training program. I still, because of the clinical role, I'm still very much involved in kind of the clinical sites. So it's been exciting for me. And I am currently working on my doctoral degree. I'll graduate this May with a doctoral degree in educational leadership.
Awesome. Thank you, Brittany. Let's go to Lizette. And I apologize, did I pronounce that correctly?
That was 100% correct.
Yay.
My name is Lizette Piedra. I'm from the Central Valley, grew up in Madera. Actually, I started school a little bit late. After high school, I went into the military and served for 13 years. After that, I think I was 29 or 30 when I decided to go straight to Fresno State and get my bachelor's degree in nursing. So in 2011, I started Fresno State, and I graduated there in 2016 with a bachelor's of science in nursing. I actually started the year before I graduated. I ended up receiving. I applied for the Valor position here at the Fresno VA, and I was one of the recipients that received that. Started working in the inpatient psych unit here. I really love mental health. So I started working here at the VA in 2015 before I graduated in the inpatient psych unit. After graduation, they offered me a job here at the inpatient psych unit and did that for a few years. And then I also, the opportunity came to become a coordinator for one of our programs here, the Prevention and Management of Disruptive Behavior. So currently that is actually, I am the PMDB coordinator for the facility, and that's what I do. So I went from patient care to educator and the inpatient psych educator at the moment.
Awesome, Lizette. Thank you. And thank you for your service.
Oh, thank you.
Okay. You know, you each have very interesting places that you work. I'm sure our attendees today would love to know a little bit about what a day in the life is like in your job. So let's go around again and kind of give us what a typical day looks like. Justin?
Sure. So a day in the life for me in the outpatient clinic, most of my shifts here are 8 to 5, Monday to Friday. I think a couple days at 8 to 4, Tuesday, Thursday. But day in the life, typical clinic, at least for me, show up here at 8 a.m. I log onto my computer, check my emails, check the schedule for the day. So we use what's called WebPT, a documentation system. You can see all the patients on there. So I look at that, see who's coming in, see if I have any cancellations, and then I'll check in with the team. So oftentimes at a physical therapy clinic, there's a lot of different roles. So therapist, physical therapy assistant, there's some, physical therapy aides as well, front office staff, my clinic director, Greg. So I'll kind of go around and just check in with everybody because a big thing with the outpatient setting, it heavily relies on just teamwork and everyone being on the same page with the patients, especially in a busier clinic like this one. So I'll just see how everyone's doing, check in, and then I go right into treatment. So there's follow-up visits during the day, and there's also evaluations. So you kind of got to manage both. And so like today, for example, 8 to noon, I had 3 evaluations, and then I had several different follow-ups. And so there's a lot of hands-on work. There's a lot of delegating to the assistants and the other staff to keep things running here. And then, yeah, usually a break at lunch, 12 to 1 or like 1 to 2. Get some food in, and then finish out the evening. So just a lot of evals and treatments, but that's just the typical flow. Yeah, during the day, get to meet a lot of different people from a lot of different backgrounds and different conditions they come in with. But yeah, that's like a typical day in the life schedule, I guess.
And I would imagine outpatient physical therapy, a lot of orthopedic, maybe low back, neck, that type of spinal things. Is that correct?
Yeah, a lot of orthopedic injuries, so musculoskeletal, low back injuries, workman's comp, a lot of work injuries. Some people a little bit different, more specialized, like Parkinson's, neurological disorders, strokes, things like that. So we see a pretty good variety. And the other thing too that I noticed at this clinic, we have a lot of Hispanic and Punjabi population as well. So that's been something unique to me, at least being out here in Bakersfield, getting to understand their background and culture. And we have translators here. So keeps things interesting for sure. But yeah, definitely a outpatient orthopedic setting.
Right. Thanks, Justin. Vanessa, how about you?
Yes, so a life here as a behavioral health therapist for Clinica Sierra Vista. So usually I do work from Monday through Friday from 8 a.m. to 5 p.m. My day goes, I have clients scheduled. I have individual therapy sessions. Therapy sessions usually run from an hour. I usually try to cut them between 40 to 45 minutes, but sometimes it just really depends on the clients that we have. Some patients take longer to speak, so we definitely don't want to cut them out. So I try to ensure to keep them within the 1 hour. I started seeing 6 clients a day, but then it became a little stressful. So I cut it down to 5, but sometimes it does get a little intense. So we want to be mindful of that and also be self-aware. Okay, I need to take care of myself. So that was very helpful. But yes, as a behavioral health therapist, we do get assigned to be a clinician of the day. And what that looks like, each therapist has a day of the week. And let's say if a crisis comes in, we get a call from the PD or anything, we have to attend, whether that is to a 5150, we have to go to the client's home, we had to call the med team just to ensure that the client is safe, the client is also in a safe place, whether they have to be transported to an inpatient unit, we have to go ahead and take care of that. So let's say, for my schedule on Thursdays, I am the clinician of the day. So if I were to be in a session with the client, I get a call, Vanessa, you have a crisis, I need to stop my session and I need to attend to the crisis. So also, as well as an associate clinical social worker, I am currently also have constant meetings with my clinical supervisors. So I'm constantly meeting with them, having case consultations. So we have a lot of support here, and I feel like we also have a great team. Each of the therapists, we communicate, we talk regarding, what best we can provide services to clients. So it's definitely very busy. I feel like the week goes by super fast. Always busy. If it's not within sessions, it's always documenting because we use a system called Cerner. So right whenever clients come in, we have to ensure we have to document everything we talked about. And of course, being aware of confidentiality. So, but also Mondays and Wednesdays, I am assigned to do assessments. So what assessments look like, so clients that are coming into the clinic, we have to assess them and we have to evaluate them regarding do they meet the criteria, because we are specialty mental health services. So if you think about this, this is level 3 clients that are need extremely help. Like we constantly need to be communicating with them on a monthly basis. So we do have to constantly be talking to them. So since specialty mental health services, we have to ensure that we have all the clients gathered together. So within assessments are actually 4 hours long. So it takes quite some time, but time goes by super fast. And by the end of the assessment, we have to ensure we create a treatment plan with the client, and we also have to ensure we have a diagnosis for the client. So I also diagnosed clients, so it's very helpful to learn, and I'm just continue growing.
Wow, that's so we're hearing a theme. We've got teamwork.
Yes.
You pretty much can count on working in a team with you once you get out there. That's awesome. That's really intense. I was curious whether, but I think you kind of answered this, whether it was just a particular, generally you see an age bracket, but it sounds like you could have people of all ages.
For us, and thank you for mentioning that. For us, I work in the adult clinic, so it's only ages 18 and up. So it's only for adults. We also have a children's clinic, but I'm currently working at the adult clinic.
Okay. Wow, interesting.
Dr.
All right, how
Saylor.
about you?
Is it okay if I jump in just real quick? So we have two questions that are kind of geared towards social work from our students. And so one of them is, after graduating, if a student wants to pursue the medical field of social work, are there any tips that you suggest on what they should do after graduating? And the second part is, do you have to have a master's degree in social work, or can you still work in the medical field with a bachelor's? I don't know if you want to maybe share your perspective, Vanessa.
Yes, of course. So those are very excellent questions. I myself, whenever I came into social work, I was just thinking I want to go ahead and help others. That's basically what I was thinking. But whenever I actually attended CSUB, I did obtain my master's. So you do have to have a master's. I obtained my master's through there, and I was influenced in my internship. I had clinical supervisors that were helping me, and they kind of oriented me to into becoming a licensed clinical social worker. I loved it. I loved working in clinics. I got that firsthand experience working in my internship in wellness centers. So that was extremely helpful for me to get that firsthand experience. And then, yes, right after I obtained my master's, right away, we had to apply to the Board of Behavioral of Science. And you have to ensure that you obtain a number and an associate clinical social work number. And once you obtain that number, then you're in the process of, obtaining your hours towards being a licensed clinical social worker. So your hours, it takes about 2 years for you to be able to obtain your license. You do have to do multiple exams. We have to do a law and ethics exam, and we also have to do the LCSW exam. And then of course, once you succeed and you pass them, then you're able to obtain your license in clinical social work.
Great information. Thank you. Megan, how about you? What's your day look like?
Sure. Well, where to start? It really varies depending on the day. But usually each day looks like some sort of combination of treatment, assessment, paperwork, and meetings. For example, today is Wednesday, and they're typically half days for our kids. So maybe I'll see kids for treatment at the beginning, and then later today I have meetings, like IEP meetings scheduled. Now I'm a comprehensive SLP, meaning that I work with speech-only kiddos, so kids just on a speech-only IEP. And then kiddos who have duplicated services with like RSP or academic services. I also go into a special day class, severely disabled classroom, where I work with students in grades 4 through 6. And that's primarily working with them on alternative and augmentative communication devices or books. So that's been really cool and a change of pace. And really, I just look at my speech schedule. I would see most kids for about 30 minutes at a time, some just by themselves, and then some in a group of 2 or 3. My Fridays are usually my assessment days, and depending on the time of the year, we may have more or less assessments. Now, in the hospital setting, I do work per diem there. It is a lot different, way more fast paced, I would say. And I would say that most of my duties there consist of treatment and assessments, depending on new orders coming through or the census at the time. And I really enjoy that as well. The schedule really varies per diem as needed. So sometimes I might go in the evening, or I may work a Saturday, just whenever I'm needed. And I really enjoy that because it's a way for me to keep my skills sharp, working with both children and adults. So that's been very rewarding.
Wow, interesting. Okay, let's hear from Brittany.
So a day in the life of an athletic trainer can look very different depending on what setting you're working in. Athletic trainers don't only work in athletic settings, and we're not only at the college level. So if you are in an athletic setting, you can work at the professional level, the college level, or the high school level. And there are even some middle schools that are starting to hire athletic trainers. So just in the athletic setting, it's different, by age group and setting. But then we are also starting to work at big industrial settings. So like Pepsi, Frito-Lay, Amazon, PG&E, they all hire athletic trainers as well. So those types of settings will look different than the athletic setting as well. And depending on the type of setting, your number of patients is also going to vary. So if you work in the high school setting, you might see 50 people in a short amount of time, where if you work at the college setting, you might see 8 people in an hour's time. So it really just depends for those types of aspects. I would say a big part of your job as an athletic trainer is prevention. So usually the day starts out with some preventative measures where we'll tape or brace or do some kind of injury prevention treatments. And then the patients will go out and actually perform their duties. So in an athletic setting, they'll go out to practice, and the athletic trainer will go out to practice with them. And I think it's important to note that, we're not just in the clinic. Athletic trainers will go out to the field. And when we're out on the field, a lot of our job kind of defaults to a first responder role. So we're there in case of emergencies. We're also the first person on the scene if there is an injury to occur. And we can do examinations and make a diagnosis on the field. Or we could also do an examination and make a diagnosis in the clinic. So like I said, it just kind of varies. While we're out at practice, for the most part, we're just kind of prepared for anything to happen, because you can have an emergency situation happen in a setting that you have been in 1,000 times, or some days at practice, nothing happens and you're just watching soccer practice. And then after practice, we do a lot of post-practice treatments, massaging, icing, stretching, those types of things. And then kind of in between all of these times throughout the day, we'll do rehabs. So we'll kind of see our athlete go from stage 1 all the way through the end, where they're at practice when they do get injured. We're there to rehabilitate them until they get back to practice, and then we go out to practice and get to watch them perform healthy again. So that's always been a rewarding experience for me.
Those are the great days when you get to go just watch soccer practice and no one gets hurt.
Yeah.
Doesn't keep you from worrying the whole time you're out there that you're ready, but Lizette, how about you?
Well, my day is different every single day. Actually, right now I work Tuesdays to Fridays. I work 10-hour shifts. And because of what I do, I actually teach in the hospital. I teach PMDB, the Prevention and Management of Disruptive Behavior. I coordinate the classes. I schedule classes throughout the month, throughout the days, where employees have to register through me. So I get a million emails of people wanting to register for the class, and then coordinating with the other instructors to see, because you need at least 2 instructors minimum to teach. There's different levels of the class. We offer a 2, a 4, and an 8-hour class. And depending on the level of risk that the department is, depends on the class that they must take. So I'll coordinate that throughout the day, registering people. Like today I have 3 classes. So this is in between the second and the third class. I'm squeezing this in. I do, depending on the day, or the month, I have to do quarterly reports. I have to report to our quarterly management team, not just my boss, but also the hospital leadership. The numbers. This class is mandatory for all employees have to take this class. The purpose is to be able to prevent disruptive behavior from happening, but how to manage it as well. So it's mandatory that everybody has to take this class, and not just once, but they have to take it every 2 years. So I have to make sure and stay on top of the numbers, make sure that all employees are keeping up with this class, sending out reminders, hey, you've missed the class, you're overdue. So please schedule as soon as possible, things like that. I'm part of 2 committees. One is the Disruptive Behavior Committee, and the other one is the Employee Threat Assessment Team. Those are where employees must report disruptive behavior, whether it's patients or other employees or family members. And in these committees, we address the behavior. We do an investigation to see what is it that happened. Is there something that we can do to prevent this? So with the committees, we meet with the Employee Threat Assessment Team. Thank God there isn't very many of those. So we meet at Liberty whenever they do come up, and I do the investigations for those. I'm the chair for that committee, so I have to investigate that and do interviews with not just the person that the report is on, but who submitted it, supervisors, coworkers. And then with the Disruptive Behavior Committee, we meet, depending on the amount of reports, mandatory, we meet at least once a month. Sometimes, like right now, we have a lot of reports, so we have to meet twice a month and take preventative measures. So we do have a safe work environment so that our staff are not disrespected. Because I see people in healthcare, you're gonna, you get hit, or you may be verbally abused or something, and that's not acceptable. So we go over ways on how to prevent that from happening, and managing it on the patient side so it doesn't happen, and that behavior doesn't continue or escalate even more. So mine's a little different as what I'm doing now to what I was before as a psych nurse. That was a little bit different. That was a little bit more structured. There I worked 12-hour shifts, 6 12-hour shifts, and 1 8-hour shift every 2 weeks. And there it was very structured. At 9 o'clock, by 9 o'clock, all patients, we had to make sure that they're up. I worked in a locked psych facilities here at the VA hospital, so we have to make sure that they're up, they had breakfast, that they're ready for the first group. We have group therapies throughout the day. Make sure that they attend, and group therapies range from anger management, communication skills, how to reduce, how to deal with stressors, and that's throughout the day. And you have about 5 different groups with them throughout the day, from those type of groups to music therapy. So yeah.
That's you deal with some really intense stuff. Seems like you and Vanessa, you represent 2 great teamwork. I mean, that's a real team right there.
Yeah.
Dealing with very similar things. You probably have some really interesting conversations together. If you,
Oh, there is a
uh,
lot of collaboration that's involved with PMDB, with any, I mean, you're collaborating you're collaborating with social workers, with nursing staff, with police officers. There's just so much. Yeah,
and you're in the VA here in Fresno, is that correct?
that's correct.
So how big a reach does this VA, what's the service area for this VA?
Oh my goodness. We see all veterans, because we only see veterans in the Central Valley. So as far as Bakersfield to Merced. And
Wow.
we've had patients as far as the coast. So the Central Coast. We also have clinics that are closer, like we have the community-based outpatient clinics, such as we have some in Tulare, Merced, and Oakhurst. Mm-hmm.
Wow. So yeah, and you're trying to manage all those in your current role. You're trying to make sure they're all getting the right training, and they're
Yes, I
spread all
actually.
over
Oh
California.
yeah, I have to collaborate
Yeah.
with other educators, with nurse managers. I'll drive out to those places to make sure that they get the training, because it's hard. For a long time, the class has had to be done in person, and so I had to go there, or they have to come to me. It's easier for me to go there, because they're never going to come to me. They're about an hour away, 45 minutes
Sure.
to an hour away. So I would go there and teach the classes there. But now, thank God, about a month and a half ago, they approved the virtual course. So now I'm able to reach them in other locations. Like, I don't have to drive there anymore. I can actually teach the class through the virtual platform.
Wow, that's
Makes it
interesting.
easier.
A month and a half ago, the whole rest of the world went virtual, you know,
I know, but not this class. And there's
a year
certain
ago.
things that I still, because there's 3 levels to this class, and I can only teach the lower level virtually. The other 2 are very hands-on, where it teaches you personal safety skills, how to escape grabs, punches, kicks, to therapeutic containment, which is a form of restraint. It's another clinical skill that we teach on how to restrain patients in. Some people compare it to a police takedown, but those I've seen a police takedown, they're very brutal. They're very dangerous. Versus when we teach therapeutic containment, we teach how to safely contain and restrain a patient without having to use so much violence.
Wow.
Mhm.
Yeah, that's intense. I see a comment in the chat. I think it's for our students that are attending from different classes and they need some evidence regarding that. And maybe they can do a screenshot or something. If we all smile at the same time, they could do a screenshot and then submit that to their instructors. So feel free, students, if you need to do that. Justin, you told us what you do on a daily basis. There's got to be, I'm sure you love every part of your job, but every job has a few things that are frustrating, and then every once in a while you have these outstanding moments. Share some of those with us.
Yeah, so every job has their outstanding or challenging moments. So like I talked about earlier, we get such a big variety of patients from different backgrounds, and oftentimes they're not just coming in with physical pain, they're coming in with mental pain, different hurts and hangups from their life. And so a lot of them bring that in here. So I think there's an emotional challenge to that as any type of therapist, really, to be able to treat them and have that compassion and empathy, but also be able to, have boundaries and respect boundaries and understand that, it's still a job. And there's a lot of patients here. So you want to have that quality, but also pay attention to the volume that you have here. But I will say, yeah, there are challenges, working on communication. Again, everyone has different communication styles and cultural and backgrounds. But I will say that a lot of my jobs and my clubs and orgs and things I was involved in at Fresno State really helped to prepare me a lot for the work environment that I'm in now, just dealing with so many different types of people with different backgrounds. And so I definitely always have a story to tell at the end of the day. I'll call my girlfriend, she'll say, how was work? And I always got 2 or 3 stories from, some patient that did something or some conversation I had. And so, I will say there's never a dull moment with this type of job with physical therapy. You're going to meet so many different types of people, again, from, so many backgrounds, and again, they're coming in with a lot of different, things going on, not even just their physical ailments. You're really able to be there for them and to get them through their rehab, but you're developing that relationship and getting them back to their life. They come in with different goals and things they want to get back to, whether that's just spending more time with their family. It could be a hobby. It could be just feeling better, right? If you're physically hurting, it affects all other areas of your life. So we get a lot of patients coming in with depression and things like that. So those are the various different challenges you're going to see: physical challenges, with rehab, emotional challenges, communication, and cultural challenges with their different backgrounds. But again, I feel like my program at Fresno State and just my life experiences have well equipped me to deal with those challenges. And I look forward to coming to work every day and just being able to interact with different people and just be that positive light that people really need when they come in here. So
that's awesome. Thank you. Yeah, that's I've heard people talk about how someone will get hurt at work and then they've got to go get therapy or whatever so they can get back to work. But really, you're not just getting them back to work, you're getting them back so they can play with the grandkids and they can do things that make life enrich their lives. So kudos for all that you do there. I bet you do hear some really interesting stories though. So
yeah.
Vanessa, how about you? What do you love? What are challenges you encounter?
Yes, there's definitely, I feel within every job, there's always going to be some type of challenge. Some of the challenges that I have encountered, since I am working with different type of clients that are schizophrenic, bipolar 1, bipolar 2, all these diagnoses that you can think of, we have, as therapists, we have to be very attentive to their progress, their behaviors. So if I were to have a session with one of my schizophrenic clients, they're doing great. Next thing I know, I need to go to attend to them, call to them. So it's definitely, they could be good. And then the next moment, it's just like, oh, Vanessa, I'm not feeling well. I need help. I need this. So it's definitely a lot of those challenges and I think one of the most important things that I have learned is definitely being able to be adaptable. Adaptability is very important. And I would say another challenge that I have experienced is some of my clients, I do have high-risk clients. Some of them do disclose to me that they have an intention of suicidal ideations, homicidal ideations. So always having to attend to them and being very attentive regarding their needs. Are their needs being met? So always having that constant communication with them. I feel like the therapeutic relationship that we establish is extremely important. If they trust you, if they know that you're there for them, they will definitely, open up to you, be there for you. However, there are other clients that simply don't see the point in therapy, or perhaps struggle to open up to others, especially to a stranger that they just met recently. So it definitely takes a lot with rolling with the resistance, but it's important. It's extremely important to be able to do that. And however, there's many challenges that do come along, but at the end of the day, it's great. And it's just rewarding for me to be able to help others, be able to provide them a different perspective, because sometimes when they are dealing with a lot of elevated anxiety, the heightened depression, perhaps the hallucinations, whatever they're dealing with, at the end of the day, they know that they do have a support system here with us. And I try to make that very clear. I'm also very transparent with them. Whenever something's not going well, I ensure to let them know. Seeking for clarification is extremely important. But other than that, just being able to be present, empathizing with them, and being able to understand them is extremely important. And what makes it, I feel like it definitely outweighs those challenges. And it allows me to, the next day I'm just like, I'm excited to see my clients. I'm excited to do therapy with them, try something new. And if it doesn't work out, then we can try different alternatives. But definitely being optimistic and showing a lot of positivity towards them and being here with them, it's what's extremely important.
Wow, thank you. Megan, what about you?
Right. So the things that I love about my job, in the school setting, every student just has their unique personality, and it's so much fun working with them. I really love exploring what works for them and also what doesn't work. And then monitoring that and then watching progress. I think it's always kind of like a fun puzzle to figure out, because like I said, every student is completely different. And then, you know, in the rehab, at the rehab hospital, you know, these patients, they've gone through something very traumatic. And here we're saying, okay, you know, they're ready for the rehabilitative process. I really enjoy just that interpersonal connection I get to have with them, and just being like, I don't know, giving them some positivity during that time. And then completing an assessment and really delving into what they're experiencing, what's different since being hospitalized, and then coming up with a diagnosis. I really enjoy that, and I really love the puzzle of it. It's a great experience.
The real problem solving that you get to do.
Right. I enjoy that, and you know, it keeps me on my toes, definitely.
Terrific. Brittany?
I kind of answered this one, but one of the reasons, I'm sure like all of us, I became an AT was to help people. And so as an athletic trainer, seeing, you know, my patients when they're healthy and they are having fun and they're loving their sport or work or life, you know, those are fun moments, but then they get injured. And I get to spend a lot of time rehabbing with them and treating them. And then that moment that they go back out on the field or back to work, and they're so grateful for everything that, you know, you did and all the hard work they put in. That's just really rewarding. I also love that athletic training has different settings. You know, I'm not in a clinic all day. I, you know, get to go outside. I get to be on the field, or I get to watch my patients perform skills that they love every day. That's also pretty awesome. Things that I struggle with about athletic training, I don't know if it's necessarily a struggle. I think it's more of a thing that you have to adapt to, is just the schedule. We don't have a standard 8 to 5 schedule like a lot of you know, people that are in similar positions as athletic trainers do. We are kind of there around a practice or a game schedule. So if I don't have a game until 7 p.m., then I am starting work around 2 and I'm not getting off until around 11. So again, it's just more of a adaptation.
Thank you. Lizette, how about you?
Well, one of the things I love about being a nurse is the flexibility that you have to go anywhere. You're not stuck in one position. If let's say you get bored with one area, you can go and explore a different area. But for me, for my current position, one of the things that I love is being able to help people. As a psych nurse, as a PMDB coordinator, you're working with people that are sometimes still are at their worst. They're at increased stress levels or whatever. And so being able to help somebody, and it feels really good and it feels really rewarding, especially when you see that and if you see other employees employ the type of training that you did provide them, it's like, oh, that feels so good. Hearing other people say, you know what, was that class that you taught, that the materials that you presented, it made sense. I can see why something works. I can see why what I did before didn't work. A lot of the stuff that Vanessa mentioned, being empathetic, that's a lot of the stuff that she mentioned is the stuff that we teach in our course. And I mean, it's not always just for patients but it actually helps throughout with everybody dealing with everyday things, everyday people. One of the challenges that is a challenge in itself. Dealing with different personalities, adapting, learning to be flexible. It's like you can't be rigid. You can't say it's this way or there's no other way. You can't. You're going to break that way. You have to be flexible, be able to work with people. And that's one of the biggest challenges is learning how to adapt to learning to work with people's different multiple personalities, different everybody's different. You don't treat everybody the exact same way. Everybody's just that it's a challenge to figure out what works for some and what doesn't work for others.
Wow, that's great. You know, all of you work with people, right? That's a common denominator. You have to know how to work with people, and I would think that's probably one of the most rewarding things is you see the improvement in those people. They learned something, they developed a skill, they actually recovered from their ailment. And then that can be one of the most frustrating things too, is when that's not going real well, right? And they're just not recovering, or they're not following directions. And hopefully you learn that you need to look back and see that you're still making a significant contribution, even when the patient or client's not improving the way you would ideally like them to improve, because you're still making a big impact in their lives. So good for you. Well, you know, Justin, we're going to come back to you, but you mentioned something interesting. You said the clubs that you participated in and the impact they made. This round, let's go through fairly swiftly, but talk about some of those things that you did while you were in school that really helped prepare you for the settings that, or the career you eventually went into.
Yeah, so a few different things I did while I was in school to prepare me. So while I was going through my undergrad in kinesiology, I had gotten involved directly with the Fresno State physical therapy program on campus. So I started volunteering with their on-campus clinics they have with the students. And so that, you know, got me good exposure to what physical therapy was, because I think a lot of questions students have is, you know, am I even going to like this? Or I've heard about it. Is it good for me? Well, you really got to put yourself out there and give it a try, you know? So for me, it was getting involved within the on-campus clinics, meeting with advisors and students through the physical therapy program that's on campus. Another thing I did was I started volunteering in local clinics around the community, right, in Fresno and Clovis. So I got an aid job working in Clovis at Function and Action Physical Therapy. So you know, definitely if jobs are available, that's going to be the best teacher, right, is experience. The other things I did were I got involved with clubs and orgs on campus, which was what you were referring to. So I got involved with OPTS, Organization of Physical Therapy Students on campus. I got to be the president of that, you know, club for a year or two, which was great. And we do a lot of work with the community with that club. And you get to meet a lot of different people, and you get people coming in from the physical therapy program to come and speak and different things like that. So I would say getting in touch with that club would be a good idea. So if anyone's watching and wants their contact information, I'd be happy to give that out and give you some resources on that. And the other things I would say would be to email a professor or advisor within the Department of Physical Therapy. Maybe it's the admissions coordinator, Ashley Hart. Maybe it's the grad coordinator, Dr. Roos, right? Maybe it's anybody just going on the website, Googling Fresno State Physical Therapy Program, go through the contact list, you know. I think that's the biggest challenge with things being virtual is not having that in-person thing on campus. So you almost have to put extra effort into reaching out to people over email or other different types of things like that, or contacting students or alums such as myself. I'd be happy to answer any questions anyone has with regards to physical therapy or getting involved with clubs and orgs or job or volunteer situations, or who to talk to, or even where to start, right? I think a lot of students say, where do I start? I really have no idea what to do. And sometimes it's just starting. So I think I put my email in the chat for anybody asking physical therapy questions. So yeah, I think I said a lot there. I'm not sure if I answered your question.
No, that was awesome. Thank you very much. Yeah, and thanks for including your email. Vanessa, how about you? What are some things that you remember from your education that were really impactful?
Yes, I feel like Fresno State, and it definitely offers a lot of opportunities for students to be highly involved, not only within the Fresno State community, but also the Fresno community, the Clovis community. And I think it's very important to take advantage of that. The support that the Fresno State staff offer is extremely helpful for students, not only to be able to grow academically, but as well professionally. And one of the resources that I was actually extremely helpful helpful for me was the Career Development Center in itself. I would always go, Nora would always see me, doing my resumes. If I needed to do mock interviews, I would always be there, contacting them, making appointments, attending the career fairs. So definitely taking advantage of that was extremely helpful for me. Also, I would say another resource that was helpful was the College of Health and Human Services, the honors program. As part of the honors program, we had we had to collaborate, doing a lot of teamwork, definitely a lot of communication skills that I was able to develop through it. So I would highly recommend that as well. If you do have the opportunity, it's a great opportunity to meet others within the major, within the college. And it's just great working together, striving, to learn more about the College of Health and Human Services and how to be able to provide the support to not just the Fresno State students, but as well the Fresno State community and Fresno and Clovis community. Another program that was helpful for me was the Education Opportunity Program, EOP. I was an EOP student, so I definitely believe that, having a peer mentor as a freshman and sophomore year was extremely helpful for me. If I had any questions regarding resources or being there, I knew that I was able to reach out to them as well. So that was helpful to me. Also, I would also say I was also a volunteer for the Richter Center. Amazing experience for me. I was able to definitely not only grow, like I said, academically, but as well professionally. Volunteering to me, I loved it and I still continue to love it. I was part of the SERV committee, which we planned and implemented different service opportunities for the Fresno State students to be involved. So it was just great experiences that Fresno State continues to offer, and we're extremely blessed to have those opportunities. But other than that, I would highly recommend. I did see some comments in the chat regarding if I had any internship or volunteer experience. I would also say that my internship, I was a peer mentor for the College of Health and Human Services. So that experience also enabled me to not only grow within, my empathy, my therapeutic relationships. So I feel like those all experiences helped me grow into the individual I am today. It helped me shape, if I had to deal with students that were resistant, I learned new methods, new alternatives. So I would highly recommend anyone to, just be involved in your community, whether that is with volunteering, being in internships. There's a lot to offer. There's a lot that Fresno State offers, and the only thing you can do is take advantage of it.
Wow, Vanessa, you gave a plug for all our great special programs. Terrific. I'm excited to see that you participated in those. I saw Lizette posted that she's going to need to take off, and I know that we're coming to the end here. But let me jump to you. Do you have a couple recommendations from the nursing field that you say when you're in college, take advantage of these things?
Oh, yeah, absolutely. Before you even, if you're starting Fresno State and you are interested in becoming a nurse, go talk to the counselors right away. Let them know you are interested. Find out what it is that you need. Take that initiative, what you need to get in. Because as many of you know, nurse and a lot of these programs, they're very competitive. So absolutely and once you are in that nursing program, get involved. I was part of the California's Nursing Students Association and the National Student Nursing Association, and it brings opportunities to travel, meet other nurses, meet other nursing students. You get to see nurses from different career paths. It's so diverse what you can do with nursing. So speaking to different people, making those connections can really help you determine where it is that you want to go.
Wow, that's great. And thank you. If at any point you have to leave, I want to thank you on behalf of the whole group.
I have a class starting pretty soon.
Okay, I understand. Megan, how about you? Let's go. Megan, recommendations?
Well, I have to say, Vanessa and I have a very similar experience and things.
Oh.
Yeah, so I just have to capitalize on what she said, really. I was also a part of the college Health and Human Services Honors Program. That was great for developing interdisciplinary communication. I was also a student leader for the Richter Center. I would highly encourage everyone to go check out the Richter Center. There's volunteer opportunities out there for everyone. I was able to gain really valuable experience working with children through them, as well as leadership experience there. And again, like the Career Development Center, like I distinctly remember Nora helping me out with my resume. Like, oh, I can't get the format. So there's tons of great resources on campus, valuable tools to help you prepare for your career.
Awesome, thank you. How about you, Brittany? Any pearls?
Yeah, my experience was very similar to what Justin described, or Dr. Lemoyne. Is that how you say your last name?
I go by just Justin's fine. Yeah.
So I remember I joined the sports medicine club, and we still have the sports medicine club. It's a great resource for students who are interested in athletic training. You don't have to be a kines major to go into the sports medicine club. You don't have to be any kind of major to go into the sports medicine club. Everyone can go to the sports medicine club if this is something you're interested in. And in the meetings, one, I got to know all of the students who were currently athletic training students, but then they also bring in members of the community and other athletic trainers, physicians, chiropractors, just a bunch of other healthcare providers that will teach you about what they do. And so from day one, I just thought, you know, I need to make sure I'm meeting these people. I need to get a variety of experiences. I need to make sure I'm ready for this. I always felt like I wanted to be very impressive. I wanted people to look at me and be like, oh, Brittany, like we want her to be in our athletic training program. And so I worked very hard at everything I did. I wanted to make sure I was always prepared. If they asked me a question, I wanted to make sure I knew the answer. You know, and I just thought I want to leave here and make this place better too. You know, I want people to, you know, who come after me to look back and think like, man, I'm glad that someone did this or paved the way for us. And so that was always something that I worked very hard towards. So, you know, getting out there, meeting people, joining clubs, and just kind of working hard while you're in college, I think will help you in the long run.
Well, thank you. Great words from all of you. And I know some of y'all have to, I took some notes and I just wanted to say a couple things. It sounded like all of you I know do internships. All these professions have internships, fellowships, those practicums that or practica, I guess, plural, that you do, where you're learning as much off campus as often you are on campus. And it sounds like you really capitalized on those opportunities. Lizette had to step off, but that even led to a job for her. So the other thing was paperwork and documentation. You can't get away from that, right? There's a responsibility you have as someone that's working with someone else that you got to document and help with that communication for their care. And then teamwork. You're working with people and for people, so you need to know how to work together. And the other one that I'm impressed by, and as someone who came to this San Joaquin Valley when I was in high school, I'm so impressed by the alums of Fresno State and how we really benefit as the Central Valley of California, that we're able to train and educate folks like you, and the incredible impact you make in our communities on a daily basis, often on an individual basis, treating one person for that 1 hour or whatever, that changes our communities. And thank you for that. It's important, and we're just so grateful to have people like you that do that. I want to toss it back to Nora. We've had an incredible session. I think this thing could go on for hours, but do you have any comments to wrap us up, Nora?
Yes, well, and I agree with you. I mean, there's just so much in information that, you know, that you all have. So we are extremely grateful for, you know, for your time. And I know there's like a lot of questions that our students, still have. So hopefully, we get to do this maybe one more time next semester or sometime in the future, but it's so great to see all of you. And I'm just so proud of everything that, that you all have accomplished. So congratulations on your career journeys, and thank you for coming in and inspiring our students.
Yes, thank you. Virtual claps. Snaps.
Thank you, everybody.
Thank you.